it's an exciting time for applied informatics in cancer care. And what I will say is that applied informatics really is about solutions. If you can envision the analogy of us navigating and how we used to navigate 10 years ago with a map that we would unfold, and today we navigate with our iPhone that's enabled with information. That's really how you should think about informatics in cancer care. So it's about providing solutions. Right now, as we're sort of engrossed in the COVID-19 pandemic, part of informatics being a solution has been the rise of telehealth. Thankfully, that's been partnered with great policy. March 6th, March 13th, and March 27th, the administration in many states passed permissive policies for telemedicine to allow us to provide virtual visits, synchronous bimodal visits to patients in their homes. It's been incredibly meaningful. And so what this has allowed is for patients during the pandemic to get cancer care as necessary without having to come into the office. It's allowed us to evaluate patients that are at high risk for infection or even coronavirus without having them come into the clinic, and more importantly, not sending them to the ER unless they absolutely need it, because that can be a high-risk place. It's allowed us to touch base with patients so they don't have their symptoms neglected, and it's allowed us to reduce the volumes in our clinic. So I can say that my clinic is about 80% reduced in terms of the volume of throughput of patients during the day, just to make it a safer place for the patients that are most vulnerable and our staff who serve them. So that's one important way that applied informatics in cancer care has been important during the pandemic. I would say there are other ways too. I think the use of big data is all about providing solutions. So how we aggregate data to try to do things like identify patients for clinical trials, or identify other applications for drugs that maybe weren't in the initial FDA approval, or identify which subset of patients may have challenges with compliance. So those are all kind of big data applied informatics solutions in cancer care today. And then lastly, and probably my favorite piece of applied informatics in cancer care, is all around decision support. So I think, clinicians are autonomous creatures, but if you can provide choice architecture to allow us to make good decisions, enabling us with information from the data, then that, at the point of care, then that allows us to take the best care of patients possible. So in my opinion, really, the telemedicine changes, opportunities and solutions with big data, and decision support systems are ways that applied informatics is really changing cancer care.